So Nisha Palani Kumar, start recording. Darling Nisha, are you our student? Unfortunately, I don't know.
Yeah, I'm a student and I can.
And you can record?
Yeah, I can. I tried to record it and it allowed me to record. So, is that okay?
Great.
Is
So
it
thank you
okay?
for your
Sorry, I should have
assistance. Thank you for your assistance. Dr. Nini, you see, teamwork, dream work.
asked.
Bravo. Okay, so we continue, all right?
Yeah.
So Peter, people, they tend to be highly focused, competitive, so they prefer competitive instead of cooperation, capable, energetic, and clear communicators. They are getting right to the point. They like to solve problems, and when they're under stress, they dig in their heels. So in order to balance, what are the recommendations, meaning dietary recommendations? So cool spices like fennel, they're recommended in the diet with foods such as raw vegetables and cooked rice. And also do not forget about specific aromatherapy, detoxification programs, yoga and meditations. So Kapha dosha. Kapha dosha is the heaviest of three doshas. It provides the structures and the lubrications that body needs. So it is the heaviest of three doshas, and it provides the following functions: strength, strength to perform physical tasks, moisturizing and lubrication, stability, mass and structure, and fertility. So within Kapha dosha, there is a predominance of water and earth elements. So like these elements, Kapha tend to be cool, stable, heavy, and in the body these qualities, they manifest as dense, heavy bones, supple skin, low level of metabolism, and large and stocky frames. And also, in addition, those people, they tend to be cool by nature, and when out of balance, Kapha people, they tend to gain weight and tend to have weakness in their lungs and sinuses. So, in order to balance, so it's necessary to add lightness, dryness, and warmth, so opposing factors. Specific dietary and herbal programs, and vegetables with very little nut components on a daily basis. And also remember that the specific oil, ghee oil, is recommended to use in Ayurvedic programs. Both this oil can be used for treatment processes as well as a nutrient, as an addition to dietary programs. So why it is necessary to define 3 doshas and these 3 components? Because by learning how to balance of these 3 doshas, the following goals can be likely achieved as a target, like prevention of diseases, meaning prophylaxis, slowing down or reversing the disease process. Here we talk about chronic diseases, and assistance in becoming totally healthy, physically, mentally, and spiritually, because based on Ayurvedic medicine, it is necessary to have a balance of spiritual and physical health. So, how do we get sick, and how any disease or illness can affect us? Because of the underlying imbalance, and in order to restore the balance and to help our body and mind to create a healthy lifestyle, in order to prevent this imbalance occur again. This is the key of a long life free from different diseases. So different ways of diagnosis in Indian medicine. Again, it is not necessary to remember these names. So by pulse, by urine, by stool, by tongue, by speech, touch, vision, and appearance. For example, referring to dentistry, can you define problems in the oral cavity by speech?
Yes.
How?
Do you mean like explaining what the problems are?
By speech, I mean how the person speaks or pronounce specific words.
What about if they have a lisp?
Sorry?
If they have a lisp, so like they can't pronounce their S sounds properly and
yeah,
things like that.
Especially if a person has open bite, you can immediately define it by speech, by the way they breathe, and of course it's indicated here by appearance. But let's make links. Yeah, appearance, maxillofacial region. Let's have links. So if a person has a class 2 malocclusion, class 2 division 1 mouth breathing, so most probably the lips gonna be dry and skin gonna be dry here. Yeah, most probably they have frequent flus and they tend to have flus. Yeah, so by this, by appearance, by speech, you already make the first notes about most probable. Of course, it's not the final decision. Most probable ways of imbalance of disease. And then when you start to collecting anamnesis, the history, of course you have to ask about breastfeeding. Of course you have to ask about bad habits. What can be bad habit here? Of the class 2 malocclusion.
The thumb sucking.
Yeah, exactly. Yeah. So little links. So contemporary Ayurvedic theory, it's based on building a healthy metabolic system, and it is also focuses on exercises, yoga, meditation, and also very important hygiene, specific hygiene process. And do not forget, when we talk about hygiene, about dental hygiene, how to properly clean your teeth, how to properly floss your teeth, and it's necessary to use mouthwash, the culture of hygiene, the importance of educating patients about culture of hygiene of oral cavity. Again, we talk about harmony inside and outside, right? So regarding Indian medicine treatments, they are plant-based. They are derived from roots, leaves, fruits, and seeds, and also it's widely used cardamom and cinnamon. And also, as I told you, consumption of different fats and oils like ghee oil, both in externally, like for example massage, or internal for as a food supplement, like dressing, for example, for different salads. And of course yoga and meditation, important component of Ayurvedic medicine. So ancient Greek medicine. Ancient Greek medicine has roots from Egypt, from Crete. Crete it's an island, Greek island, the biggest Greek island actually, or from India and from China. So Greece is considered as a cradle of culture, of democracy, of philosophy. Let me open, maybe I have different pictures from Acropolis Museum and I wanted to show you them. These pictures, they are about dentistry and medicine. No, I cannot open. Okay, I will upload to the PPT at Drive and you will see them. So, ancient Greeks, they believed in gods and in magic. And gods can cause diseases when they are angered by people. And also they can provide treatments for those they favored. Magical practices are mentioned in myths and poems. I hope you know ancient Greek mythology and poetry by, for example, Homer, and also philosophy by prominent Greek philosophers. And medical treatment of war injuries, they were generally empirical, but when it's failed, the healers might resort to medical practices. Also keep in mind that although in ancient times there have been many wars inside of Greece of different regions, however, it was a religious ban for investigating. And that's why the knowledge of anatomy and physiology, it was limited due to religious ban. So, Asclepius, god of medicine and son of Apollo. Apollo was a god of culture, if you remember, right? So usually Asclepius is portrayed with a staff and snake. And Asclepius had a daughter, her name was Igea, and usually also she's portrayed standing on the back of Asclepius, helping to treat patients. So what are the main concepts? You know, in order for you to understand the main concepts of ancient times, if we refer to medicine and dentistry also. So each and every large city in ancient Greece had an acropolis. Acropolis meaning the city on the top. Acropolis had a temple of a god that this city were referred to. For example, in Athens, it was Acropolis of Athens. In city of Lindos, it was Acropolis of Lindos. Understandable? So based on city. And next to Acropolis, usually it was a specific place for devoted to Asclepius, and usually people, they could come there and ask for medical assistance, and ask for, or pilgrims, they can stay there. So this was the main concept in ancient times. However, please take into consideration that it was a culture of not only in medicine, yeah, in specific lifestyle, but also philosophy, poetry, socializing. They had specific places for the meetups, theater. For example, next to Acropolis, there are 2 open-air ancient theaters. So it was a specific lifestyle for ancient Greek people. Also, let's not forget, as everything in ancient times was associated with some kind of magic, and do not forget about this influence in ancient Greek about medical astrology, and the influence of it to different body parts or causing the disease. So methods of treatment in ancient Greek. So the main methodology was do not harm principle, that was invented by Hippocrates, one of the most prominent ancient Greek doctor. And in order to restore the balance, it was prescribed the good diet, exercises, specific drug therapy, and sometimes, of course, surgery. I told you already about situation of surgery in ancient Greece because of the limited anatomic knowledge, because of the religious ban, and that's why surgical procedures, they were used to handling war wounds, and hence it was a religious ban for the dissecting of cadavers. That's why the knowledge of anatomy was limited. However, one of the most prominent scientists of medieval times, Leonardo da Vinci, he put a great effort and step forward for the development of medicine. Of course, it was a unique personality that he made a great contribution not only to medicine, but to art and science in general. So bloodletting. Bloodletting was associated with life, and it was devised by Hippocrates, and then later on it was systematized by Galen, another prominent doctor, but in ancient Roman times. And it has served for centuries as a methodology of treatment. So Hippocrates was the first doctor who known, and we have evidence, who described the cancer and described the face of a person who suffers from cancer. And it's named also Hippocratic face. Here in this slide, you can see the explanation. So of the appearance of a person who suffers from cancer. So the nose is pinched, the eyeballs, they are sunk, and the temples hollow. Ears are cold and retracted. So these are all these features. They were explained and described by Hippocrates. Also, Hippocrates he has made a great contribution to modern orthopedics. He developed the principles of traction and counter-traction, and he invented the special bench of scamnum for a device that used for tension to aid in setting boards. So it was the basis of the modern orthopedics. Medicine in ancient Rome. We have to know that ancient Rome culture and ancient Greek culture, they were pretty much similar. They had the same gods, approximately the same gods, but with different names. However, we all know the history of ancient Rome, the huge expansion, and that's why, if it's logical, if the land expands, there are wars and acquisitions of a land, and that's why it leads to war wounds, and that's why this division in medicine, traumatology and surgical wound therapy and so on and so forth, it was highly developed at this time. And one of the most prominent doctors at this time was Galen. He has written numerous books and explanations about war wounds therapy, about surgical treatments of the war wounds. And of course, do not forget about great contribution of the Roman world towards public health and prevention of germination and spread of different infectious diseases. And the culture of Roman baths and the culture of hygiene, I should say extreme hygiene for that times. And also Roman baths, they were considered as a culture of socializing and interaction of people between each other. So it was essentially an important part of lifestyle. I told you about Galen. So okay, so for today we have finished. For the next lecture, we will have topic about modern dental guidelines in your profession. That they were published by International Dental Federation. And we will consider also different cases. Yes, all the presentations, they are downloaded after the lecture. The first lecture is downloaded already, right? Yeah. Everything will be downloaded to your Google Drive by the end of the day.
So is next week the last lesson that we have just
with me?
Yeah, and then the week after that, it's with the medicine students as well.
Because you're gonna have a communication, ethics with Mr. David, and then after you're gonna have communication topics regarding communication.
Okay, thank you.
Okay. So I hope you're doing well. I hope sooner or later to see you. So please inform us if you have any questions or concerns. And thank you for your attention. The lecture will be uploaded by the end of the day on your Google Drive, okay? Bye.
Thank you.
Thank you.
Thank you very much. Thank you.
Thank you.
Bye.
Thank you. Bye.
Thank you.
Bye.